Good afternoon. Let me start off by telling you today, give you a little update, if I can. I got to tell you, to be right honest about it, I lost a contact on the way down, so I'm going to try to do this. But I believe there is 6,322 positive cases as of today, and 218 deaths on that, and about 56,000 people in Missouri that have been tested. A couple of things today that have worth mentioning. The Bartell machine come in today. It's actually here in Jefferson City. We were excited to get that to give us the ability to be able to take and decontaminate up to 80,000 of the 95 masks that we'll be able to do across state. There'll be 13 locations where people can drop that off and then bring them in here, and we'll use the machine for that and do up to about 80,000. So that's good news for us in Missouri. That's here. I think people are working on that as we speak today to get that set up and to go on that. The other thing I want to mention, every day we're starting to work on the testing side of it. We're starting to look at policy and procedure for reopening the economy. Hopefully we'll be able to put more on that towards the end of the week. Next week on Monday, we hope to be able to have the guidelines that we maybe be able to push out to the public so they'll be able to see what those are, and then so the businesses can get prepared to open up the following Monday. So we're on course to do that, but with that, time yours, we're ready to take some questions. Dr. Williams is here today. Director Karsten's here. If we got some questions that they may answer, they're here to answer your question too. So Kelly, you want to go?
I was wondering if you had any concerns about the Attorney General's China lawsuit in regard to the economy. Do you have any, given Chinese companies' investments here?
Well, not at this time. We're not aware of any things that's taken place on that at this point. Again, I think for all of us, we're pushing towards the date when maybe we don't have to be reliant on other countries right now to meet the demands. But we're well aware of that, and we're working through that.
Okay. I mean, so have you heard from any concerns from chamber folks or any companies with Chinese companies with presences in?
I have not through the governor's office.
Governor, given the report from Wisconsin that 19 voters and poll workers have come down with COVID-19, are you reconsidering your decision not to recommend the legislature expand absentee voting?
Yeah, it'd be up to the legislature. Again, the Secretary of State needs to have a huge input on that in the local levels of how we're going to deal with the absentee voting. And I think, then again, the legislators are coming here if they want to make a change to that. We'll see what that change is. But again, I think that's the Secretary of State, the locals level, to try to decide on that. And we'll see what the legislators do when they come in.
Governor, a follow-up. Do you mean that it's up to the Secretary of State to recommend something, or do you think, as broad as Missouri's absentee voting law is, that he could simply say anybody who wants to can request an absentee ballot?
No, I think that needs to go to the guidelines of the Secretary of State's office. He's in charge of the voting here in the state. I think that's his job. I think you got your local county clerks on the local levels to have some input into that.
Governor, just a quick clarification question first. Did you say on Monday that the new testing criteria would be made public, or the guidelines for reopening?
Okay, I couldn't hear what you said.
Did you say on Monday that the testing criteria would be made public, or the reopening guidelines? Just a quick clarification.
On Monday, is there a new order being talked about, or will the testing guidelines be talked about?
The new orders will be talked about opening up the economy. The testing guidelines, as I mentioned yesterday, we're broadening them as we speak. Director Williams did that yesterday. We have now put that in the providers' hands if they would like to test people in the state. You know what we're really trying to get to is what is the capacity of testing we can do towards that May 4th date. It's what we're looking at. What's the capacity? You know, one of the things we're finding out right now, not as many people are being tested as what wanted to be tested was. The demand's not there like it once was. But I want to go back on the testing side of it because I want to make this clear. Part of the plan is to reopen is that we can target certain areas if we needed to. If we need to go into a large-scale area to test all employees, or again, I'll use a nursing home or a large business, we have the ability to do that. We have the ability to do that now. We just want to make sure we want to expand that where we can do other things.
And then, is there any more of a plan currently for getting state workers back in the office?
State workers back to what's our plan?
Yeah, there'll be a plan in place. We got people in the office that's putting that together along with the directors across the state. We will gradually bring people back into the state, what we can, when we can. But I think it's important to remember that a lot of those state workers are out there working every day. Most of our larger departments, corrections, mental health, the health department, public safety, all of those people are out there on the right now. But we'll eventually bring people back in when we feel like it's safe, and there'll be a procedure for us to do that to make sure it's a safe environment for them to come back to work, and then also for the public to come in to do their business.
Governor, yesterday, Illinois Governor J.B. Pritzker mentioned that he hasn't had any luck working with you regarding the shared area of the Metro East. Do you have any comment on that, or why he hasn't had luck?
On the CARE Act, is it?
Shared area of the Metro East.
Yeah, I'm not understanding the question, I'm sorry.
Illinois Governor J.B. Pritzker said that he has not had any luck working with you in reopening the states together in a shared plan for the Midwest with the shared area of the Metro East.
I mean, I talk to governors every day. I talked to governors last night. I think I'm talking to some more tonight that's on there. So each one of us have a different plan on how we're going to reopen our states. I mean, you can compare any state to whichever one, Illinois, Kansas, Oklahoma, Nebraska. All of them are basically different in their own rights. So for me in Missouri, I'm going to go back to what I've said from day one. It's about really where are we at in the state of Missouri? Where are we at with testing? Where are we at meeting the pillars on that? The hospitals availability, all of those things. Again, what I learned early on was I need to figure out to have a system in our place, a model for Missouri that deals with just Missouri. And what everybody else is doing, I can't worry about so much what they're doing. We look to see on the national level for reference. But again, it is so important for us to have our own data and our own availability to make those decisions with real data instead of speculation.
Some health professionals have expressed some concerns about reopening businesses as soon as May 4th, as you've mentioned. They've talked about a possible second wave. Is Missouri prepared for that? And if we do experience a second wave, would we incorporate stay-at-home measures again after that?
First of all, yes, we are prepared for that. And I think when you really look how long we've been dealing with this, I think on our calendar it's less than 50 days for all of us. And it seems like we've been doing this for months upon months. But when you look at what's happened in that 50-day period with our medical people around the state of Missouri, with our hospitals, with our businesses around the state, with government, with people, everyday people just stepping up to fight this virus, it's been incredible what's happened in the last 50 days in the state of Missouri. We know much more about it than we did 50 days ago. We've been able to almost do things that has never been done before, waiving 450 regulations and policy in that short period of time. The federal government doing what they're doing to get things out on a much quicker scale. But yes, I think we're going to be much more prepared for that second wave when it comes, if it comes. I think you're right. So we're going to be prepared. But the one thing I do realize, you have to do both. You have to be able to fight the virus, and we have to open up the economy. Those two things have to happen for the state of Missouri. I firmly believe that, and we're going to proceed with both of those issues doing them at the same time.
Governor, I'm sorry, Kelly. A question from Rudy Keller from the Columbia Tribune, and I'll kind of read it because I want to make sure, I'm like Kelly, I don't want to get it wrong. Should Congress provide financial support to states like Missouri to deal with coronavirus budget problems that states are suffering?
Yeah, you know what, I think they are right now by doing some of the things they're doing. I mean, if they're not backfilling money towards the hospital, to the people that are out cost on COVID-19 and the insurance, the Medicaid, you could almost go on down the list, we'd be in much worse shape than we are. If the question is, do I believe the federal government should bail the states out? I do not. You know, if they're going to help with that, that's fine. But I know the question came up yesterday, Phil, you know, what do I feel about if states file bankruptcy? Look, if you put yourself in that bad a position as a state and you can't get out of that, unfortunately, that's the state's responsibility. You shouldn't be out there asking for the federal government to bail you out on everything. And number one, it is totally not fair for the states that do a good job of managing their money, all of a sudden don't get that. So I think the federal government's going to be very careful when they go out there and say we're going to bail the states out. There's lots of ways they can help. You know, I'll be honest with you, I'd much rather see an infrastructure bill on the federal level than I would them just giving us money.
So you don't, as a follow-up, you don't disagree with Mitch McConnell's comment that states can just go bankrupt rather than Congress providing more additional money?
Why would states go bankrupt? First of all, why would they go bankrupt? I mean, over years and years, you know, under the Constitution, you have to balance your budget. Just like everyday people that's lost their job out there, they got to figure out how to deal with this situation. Why should states be exempt? I mean, we've went through hard times in this state. For decades, we've went through tough times, and we've been able to manage. I'm not for sure why all of a sudden, because something that's happened 60 days, all of a sudden we need the federal government to come over and take over the entire systems of state government and bail us out of a bankruptcy. I just don't believe in that.
Yeah, so you've said that businesses can start to reopen May 4th, but schools are going to be closed for the remainder of the school year for in-person learning. Do you have a plan for childcare for parents who have to get back to work?
Close schools down now to the end of the school year, and you're considering opening businesses up on May 4th. Do you have a plan, or your administration have a plan in regards to childcare for those children?
Yeah, well, I think there's been expand on that. There was, again, some federal money that come down for daycares and childcare to expand in the state of Missouri. We're going to continue this. One of the things we knew when the schools started shutting down that we were going to have to face that daycare situation. And that's going to continue on. That problem's not going away. So I think, again, some of the money that's come in to kind of prop that up, to expand those hours and to help to provide more care. But I think those are the things that, look, we're going to look at that from a point of view where whatever it takes to get people back into the workforce, and if daycare is part of that plan to get us all back to work in Missouri, we're going to look at things like that all day long. Because what we want to do is have enough tools in the toolbox to put people back to work and get the economy going.
Governor, in both Saline and Montauk County, there are meat processing plants or other plants that have significant outbreaks of COVID-19. Are you concerned about that? And is there anything you can do about that?
Yeah, on the plants, on the processing plants, yeah, we're concerned about it. Not so much as it was a processing plant or anybody where there's a large volume of people there together. But again, it's one of the things I talked to Dr. Williams about that we were looking at last week when we were talking about opening up and expanding testing. Could we really go in there to a plant, a full-size plant, and could we do full-scale testing? And the answer to that is yes. And a matter of fact, we'll be in the process of doing that, I understand, the next couple of days, just to make sure we don't get into situations like some of these other states do. So if we got a large company, a large processing facility, we want to be in front of it, and that's been part of our plan from day one once we have the capability to do that. So we'll be able to do that.
So are we going to be able to do that in the next few days? Is that the plan?
Yep. You know what? I'm going to let Dr. Williams answer that. I think it'd be much better. Dr. Williams? And if you have any other questions while Dr. Williams here, you might just go ahead and ask them if you don't mind. We don't switch back and forth all the time.
Great. Thanks for the question. And you mentioned which county? The Cusic's here. Yeah, gotcha. So, yes. So, as the governor said, one of the things that we're transitioning to is that we now have the testing capability that we would not have had 3 weeks ago or 4 weeks ago to do what, again, we call a boxed-in strategy. So for those two counties you talk about, I'm very familiar with those, we will be going in and bringing in testing in. In addition, we have another county that we've worked on all day today, in which we will be going in tomorrow and Saturday and Friday and doing 3,000 tests at once in a meat packing facility. And that enables us to go in and identify all those patients, both symptomatic and asymptomatic, and give people the comfort of what the disease prevalence there is, and identify those people who are. So I can't thank our local health departments and the companies and the providers who've all come together to do that. Now, in the two counties you say, we have another plan that we'll be executing, I hope tomorrow, to do some rapid testing in those two communities. So that's the whole purpose of where we're transitioning to, is that we now have the testing capability, whether it's a nursing home or this facility we're going in tomorrow, or the two that you mentioned, to go in and immediately start doing testing.
Do you have any idea when you're actually going to be able to get that rapid testing deployed?
Well, I'm trying to get the machines to them today. If I can get machines to them today or tomorrow, then we hope to get that done by Saturday, I would think, if they can make that happen. Yeah, so those 2 machines hopefully are en route.
Dr. Williams, hi, Ashley Bird, Missouri Net. One of the actual questions for you, two-part question about nursing homes as well. Has the state drawn down the $90 million for infection control for nursing homes that was made in the supplemental budget? Has that been drawn down yet and employed?
Not to my knowledge. I think they're working with the guidelines on that, so not to my knowledge, no.
Okay, so what's the timeline on that?
I would have to defer to the governor's office as to the distribution of that money.
Okay, I do want the governor to address that, but the other question is, since nursing homes are not hospitals and often don't have full-time medical staff, what can you do to help them with the virus treatment itself? Are there any backstops? Are there any special teams? What's going on there?
Yeah, a great question. Well, the first thing is prevention. We would, want to just make sure. I think the governor mentioned 2 days ago that as we open up, the last thing that will probably open up would be long-term care facilities, because so much of our morbidity and mortality is coming from those. So, we are going to be constantly using best practices. That's going to be maybe the new normal of taking temperatures, making sure we have enough PPE for all of those providers. Making sure we're very much watching symptoms very quickly. And then the final thing that we keep talking about is going in very quickly and doing a lot of testing. There's even talk by Admiral Burks about doing sentinel testing, where you don't even wait, you just kind of periodically go in and check, just randomly. And we will have the testing capability to do that. We have 1,600 nursing homes, but I think we'll have the capability to do that.
Do they have the medical treatment capability right now, though?
Well, again, there's not an antiviral for COVID-19, so we don't have a treatment for it. And so, really the key to COVID-19 is early identification, and for those people who are developing respiratory symptoms, to get them into the hospital for supportive care, oxygen or ventilators, as quick as you can. But we don't have an active treatment for them.
All right, so the question was the governor on the drawdown. You wanted to address that later or no?
The drawdown money, they're working on that, the guidelines that we're working on that, but they should be able to draw down on that in a very quick time fashion. So I'm saying like a week or two, we hopefully will be able to prepare that. But again, staff's working on that, the administration's working on that. But I think that's an answer we could probably give you a more definite answer, maybe through the office. If you just kind of send Kelly that question or something, we'll see if we can't give you that time frame of when that is and how that would go into effect. But we can do that. But that money's there, and it'll be there. Let me just talk about the nursing homes. Tomorrow, I believe our plan is tomorrow when we have the briefing tomorrow that we'll be giving you guidelines of how we're going to reopen the state. The different things that how that might look, whether that's the big box stores, whether it's restaurants, nursing homes being one of those things. I think one of the things you got to remember on the nursing home, and I'm a person that's went through that with my own parents on that, there's also, those are real people in there that are real family members and that are loved ones of somebody. So we also have got to protect them. By all means, we got to protect them, but at some point, we're going to have to let the families go in there and see them at some point. So there's going to have to be some precautions put in place, and maybe that's under a hospice situation. I don't know, but we're going to have to give some guidelines for people to go back there and see their loved ones at some point to be able to do that. And how do we do that safely? But those are all the things that we're trying to work on to figure out how do we address those issues, because the reality of it is these nursing homes have been locked down for good reason. We're going to continue to keep them very secure because we know the reasons. But at some point, 60-day period of time, people probably need to see somebody in the nursing home, and they need to see some of their loved ones too. So I think those are the things we'll be talking about tomorrow with multiple other things.
Yeah, a question for the doctor, actually a two-part question. One is, what's your estimate as to when the average Missourian would be able to get a reliable antigen test? And the other part of that question is, how important is that for Missourians who are thinking about whether or not they should take a trip somewhere to another state, to another country? Should they wait until they can find out if they've got antigens against this thing?
Yeah, it's an antibody test. There are multiple ones on the market, but many of them have not been validated, so I just caution that. We think ours will be up and running in about 2 weeks. We'll do 175 a day. I've been on the phone call with several doctors today. And I think that those tests will be very available. They're manufactured in the thousands upon thousands. It's just a little a stick of your finger. And so I do think they're going to be widely available. I think that they'll have some utility for people, just regular asymptomatic people to get, because I think they're going to be very easy to get. And then I think you can use that information. But I have to tell you, in the prevalent studies I looked at, and it's very, very early, a reasonable expectation would be only about 5% of those will be positive, that we won't have a lot of those tests initially to be positive out of 6 million Missourians. And so I wouldn't exactly count on those to make broad plans, because I think for most Missourians, those tests are going to be negative, at least initially. So I wouldn't say I'm gonna get my test to decide whether or not I make a trip in July or August.
Did I hear you correctly? You think this is going to be available for not just healthcare workers, emergency service personnel, but for the average Missourian in
Yeah.
2 weeks?
Yeah, I think right now they're available. I think the question is the validation of them. There are not that many that are FDA approved. I was on a conversation today with a doctor up in St. Joe's, and he said that he could get thousands of them today if he wanted. But the question was the validation of them, of the antibodies. And so,
A personal question, and forgive me for asking
No,
this.
that's okay.
But would you take the antigen antibody test before you flew out of the country, before you flew to another state?
I wouldn't at this point, but I think I'm sure that I will get one at some point. I suspect, just because I think it will help me guide what I'm doing. But I don't think I'd get it specifically to just to go on a trip. But yeah, do I think that I will probably have an antibody test sometime between now and September, October? Yes, and I think they'll be incredibly available.
A question for either the health director or the governor. There are some communities in Missouri that are already lifting their restrictions. Do you want them to follow the statewide stay-at order, or to do what their local communities feel is best?
Well, we would like for them to follow the state order, to say the least, because the state order is still in effect. So even if they lift theirs, the only thing they can be is more stricter than the state guidelines, but they can't lift the state guidelines. So it's anything they have stricter than, otherwise if they were, if they take theirs off, they would fall into the state guidelines.
Are there any repercussions if they don't?
Well, they're going to follow the law like everybody else does. I mean, in the state, it's why I think it's so important that we are all on the same page as much as we can be. Now, we know some of the areas are a little different. The bigger, if you look at St. Louis and Kansas City's got more problems. St. Louis more than Kansas City. But for the most part, I think it would be a good thing for the people to have certainty when the date we're going to open up, and it's all on the kind of doing it on the same page. I think that's important to have that stability. The other thing I think it's important for people to realize you're going to open the state up for some length of time, that they know how to figure businesses, and we know that how we're going to do that. So I would assume right now that order, I think I'll be able to tell you for sure, but I think that order probably would look like more like a 30-day, a June the 1st order or something like that we would be doing for our guidelines. But I think it would be easy enough for people to match up. And then I also think when St. Louis, Kansas City, some of them, that maybe it's got a little longer date, they could match up with that. And we all, because like I said, I'm in contact with the mayors across the state and elected officials, so we'll just kind of see how it goes. But I think it's important to be uniform.
Governor Parson, a lot of people are still having issues getting through to the unemployment hotline that the state has provided. Is your administration working on any sort of solutions to help kind of relieve that workload?
Yeah, I think they're doing a much better job over there. I mean, I'm going to say they've been doing a good job from day one under the circumstances they were. We've never had that kind of volume before, but no states have. And ours has held up much better than most of the states around us, or in the United States, if you compare what the directors over there have done. We've brought people in to work 24 hours a day, 7 days a week from other departments to help with that. We've tried to put things in there like on phone banks, how we can do a better job of that on the call centers, how we can bring in the people to answer the emails. And then it's the other thing is just to be able to process all of that. I'm not for sure where the numbers are as today, but I think it was last week when I was in here, they had processed like 115,000 claims like within that week, and that's a pretty incredible number considering everything. But it was just a matter of volume and still being able to get the people through the system. And again, we're getting better at that every day. But we want to process and get that money out as soon as we can.
And Governor, the federal guidance says states can't use stimulus money to make up the lost tax revenue. So how is the state and you going to prepare the next budget to make up for that lost revenue?
Yeah, you're just going to have to tighten the belt. You're going to have to go in. We're going to have to look at the budget with the legislators and figure out how we're going to do that. Look, there a lot of times when things are good, there's a lot of programs out there. A lot of things are added. You do a lot of great things. But we also do a lot of great things that government was never intended to do, that we don't have to do. So really, my view of that was we go down to what's the basic things that government's supposed to provide, what are those basic fundamentals, and you build out from there. But we're just going to have to do a better job of managing the money. I also, when I say that though, I am optimistic that in that third and fourth quarter, we're going to start seeing an incline in revenue in the state. And I think things, the way the situation occurred, again, we're 60 days into this. Those markets are still out there. I believe they are, and I believe people's going to get ready to get back to work. I think the companies are going to be able to pick back up fairly quickly, much more different than a recession. And I think in that third and fourth quarter, you're going to see the revenues come up in the state of Missouri, and hopefully more revenues for people. But it's going to take a while, and it's just going to have an effect on the state. We just got to manage the money. That's what the Constitution says, and there's ways to do that. There's ways to do that and still provide the services to the people of the state of Missouri.
Governor, President Trump recently said that Georgia's Governor Kemp was reopening parts of his state too soon. Is your plan more in line with the federal government's plan?
Well, I think that, again, I don't worry so much about what the president says or what the other governors do. Here's what I know. I think the president's orders are the same weekend as ours. I think his is on Friday, ours is on Sunday. The only reason there's no reason to Friday versus Sunday. We announced our order first, but it was really prepare everybody for the first of the week. We thought just coming up on Monday, everybody would know it's time to go to work on a Monday. Gives everybody time to prepare their businesses, for inventory, for stock, and really to notify people to come back to work, to make sure everybody's good, and to give the businesses the opportunity. Okay, what is the procedure you're going to use to bring employees back, and what is that's going to make employees feel safe when they go back into those businesses? So that's kind of the theory we did that, Monday versus a Friday. It was simply we're just thinking it's a work week, and I want people to go back to work.
Non-coronavirus related, but I spoke with Speaker Elijah Haar yesterday about the legislature coming back next week. Predominantly, his focus is on the budget, as you've mentioned, but he also said that he thinks there's an opportunity to get the statewide prescription drug monitoring program passed. All it needs is a final approval in the House. Would you be willing to sign that bill?
I'll answer that like I've done ever since I've been governor, depending on what that bill looks like when it gets to my desk. I always get that question like, would you sign that bill if it come? I've been supportive of that for many years on the PDMP. I've been supportive of that. But again, it depends what all's in that bill when it comes to my desk. I've been around here way too long to realize that people add stuff to the bill all the time that try to get something passed at the end. So I'm reluctant to ever make the commitment that I'm going to sign it, depending on what's in it. But if it's something I've supported, so I assume if it comes as a clean bill and it's things that was right in it, and it's constitutional, I think there's a good chance I would sign it.
On the budget, have there been any furloughs or cuts to state workers' pay? And if not, is that a last resort for you if it comes to that?
I heard the cuts in the budget.
Of the state workers, do you anticipate any furlough employees or any cuts in employees?
Yeah, we're going to evaluate everything we got on the table. So, we're going to take a look at that to see what's out there. We maybe look at again on financial, on early retirements. There's some things that we can do that we've done before in times like this that we're going to take a look at. But look, everything's got to be on the table. But the reality of it is for businesses out there, especially the small businesses, they're going through the same thing. You got to make tough choices at times like this, and the state's no different. There's nothing guaranteed about the state being able to get through this process without having to feel a little bit of the pain too to get through it and figure out how we do it. But again, there's a lot of moving parts to that. There's a lot of state employees out there. So we just have to take a look at that and see where we're going.
That has not happened so far?
No, no, it has not happened so far. I think the other thing you got to realize with state employees, and I'm not for sure the exact numbers, but the large majority of state employees are working every day. Because you're going to look at your Department of Corrections out there, which is a vast, huge one of the huge agencies, Department of Public Safety, SEMA, all those organizations that are out there. Your mental health groups that have to be taking care of people every day that can't take care of themselves. So there's a lot of people out there working on a daily basis in state government. But again, we're going to look at everything. I've talked to my administration about that. We're going to put everything on the table. But we got to start going through the budget and really look at where we're going to start with and what all's going to be available to cut.
Okay, we should have time for about one or two more.
I do have two. Governor, this has to do with the budget as well. One of the things that you did mention in your budget was the elimination of about 325 full-time equivalent state worker vacancies. Is that a possibility that you'll increase those for some filled state worker positions?
What was it? I didn't catch it.
Okay, can you understand? You had included in your budget proposal 325 full-time equivalent state worker vacancies. Is that correct?
I didn't hear it. What was it?
And will that number increase?
Will that number increase?
No, I don't think there's going to be an increase in employees on that. If that's what is that what you're asking me?
You included cuts, 325 vacancy cuts.
Oh yeah, yeah.
Are you now looking at possibility more fulfilled positions?
Yeah, I mean, look, this revenue number's changing every day. So I mean, the reality of it is, by the time the legislators get here next week, there'll be new set of numbers that we have to look at. You know, the unemployment numbers keep going up, revenues keep going down, and we're going to have to figure out in 2021. However, by saying that, we also know we're going to open up the state. We also know people are going to go back to work, and we're going to start curving that to be able to do that. So I'm just telling you right now, there's a lot of unknowns. We don't know exactly yet what the second round of stimulus from the federal government might be, what they're going to be able to backfill on some of the things. So I just think there's a lot of moving parts to this entire budget. And I'll just be honest with you, I forecast whatever the legislation does, I think we'll be back. I think we'll be back at some point in a supplemental process that we're going to have to deal with some of these things. So, you know, we'll see what everybody does. We're working with the legislators every day with their leadership and people, trying to make sure that we're informed as much as we can with each other and going to move forward.
My last question has to do with prisons. We've talked quite a few sources where people are not wearing masks in prison or adopted masks late, and obviously there's not a lot of social distancing going on in some areas. What kind of exception and what are we doing to enforce that kind of safety in state prisons?
Look, I'll say this again, Director Preside has been doing an outstanding job in our prison institution in this state. When you look at what's going around in other states, Arkansas right close to us, we've been incredibly fortunate. But again, I think we were prepared early on in this state. The directors, we were on this really early. Dr. Williams met with the directors early on to say, this is the real deal. There is a lot of risk for you, and went over who all had those risks. And I think, again, the Department of Corrections has prepared very well for this. Not to say there's not going to be positive cases coming out of there. There very could have, that mass of people there. But I'm telling you, Missouri has been very fortunate at this point to be able to handle that. And again, I think that comes with the guidance we used early on and the safety precautions we're going to do. And if it means, you know, if the director feels the need for people to wear masks, then the director's by all means going to have the ability to go in there and say that to the employees. Because we want the employees to be safe, and we also want the people that's incarcerated to be safe. So there's twofold there. So whatever it takes to make them safe, I'm going to leave that up to the director to make those decisions and make those recommendations to the governor.
Any other questions?
One last one. Going back to the Georgia governor question, a lot of their concerns revolve around opening up non-essential businesses that can't prevent or can't enforce social distancing, such as, you know, barber shops. Are there any restrictions or guidelines that you'll have for those as you continue to open up the state?
Yeah, and I think we'll talk about that more tomorrow, but there'll be guidelines for for salons, for your barber shops, for your restaurants, your bar areas, all of those type of things where you have to be in contact. There'll be guidelines, we'll make recommendations on it. By saying it, it may be a good one to close on here if that was the last one. But again, I think what we have to do at the state level is give somewhat broad guidelines for the local levels. Because at the end of the day, they're the ones that's going to have to decide what is it you really want in your communities. Whether you're in any part of Missouri, whether you're in Chillicothe, Missouri, or whether you're in St. Joe, whether you're in Sikeston or St. Louis, those mayors and those county commissioners will have to be the ones that really decide, how do we run our swimming pools? How do we run summer league? How do we do this? I mean, you can't do really a state blanket for that. So what we're going to try to do is, with the main theory of the guidance I'll be talking about tomorrow and some of the things we'll be doing, social distancing will be the key to that guideline of how we do that. And you know, and I know the question is going to come up, so I'm just going to answer it right now. Well, what are you going to do about enforcement of that? How are you going to do that and all that? You know what? The people of this state have stepped up in the last 50 days unbelievable. And I believe the people of this state, for the most part, will take that responsibility on themselves. Yes, there'll be guides and there'll be people on the local levels who will have to figure out how to enforce that. But I truly believe most people are going to want to get back out. I think parents are going to want to get their kids back out in activities. And I think they're going to abide by social distancing the best they can. I think they're going to take their personal hygiene very serious, and they're going to make sure people are much differently the way we done. We will change, our lifestyle, all of us will change somewhat. And it'll be brought on, not by government, it'll be brought on by each and every one of us that are here today, and the people that's listening out there will make those changes, because at the end of the day, you want to be safe. Phil asked a question earlier when he was talking about testing. You know, when this all took place, there was a lot of fear. People were scared, and rightfully so, because there was a lot of unknowns to this virus, to what was going to happen. How much was it going to spread across the state? Everybody wanted to be tested at first, everybody. You open up a mobile site and there'd be lines of people coming up to be wanted tested. The reality of it is not near as many people wanting to be tested, you know, as of today, because we're learning out how to deal with this, and we're going to continue to get better at that every day. And I think someday you'll be able to go to the pharmacy, you'll be able to go somewhere, and you'll be able to get tested on your own. You won't need it. But I think it's important to realize people are starting to understand a little bit more about the virus. They're understanding it better, and those demands are going to change. But I do think one thing, people are going to be cautious when we first come back out, and I think they're going to take that responsibility on themselves. And that's the best way to fight this virus, is all of us doing our part as Missourians to do that. So with that, thank you all very much. I will see you tomorrow. Appreciate you being here, and I look forward to seeing you again.